And I'm in pain because these doctors and nurses, like I'm telling you, and I'm telling the truth, I'm telling the world now, tried to murder me. And they tried to murder me, and I'm telling you why they tried to murder me. I won't tell you the full reasons because some people really have a hard time believing me, but there are some very wicked people. You need to read Dr. Rebecca Brown's books on the practice of Satanism growing in this country and around the world, and how Satanists have exist among doctors and nurses in certain hospitals, and how they band together to form these death squads, and how organized they are. Lots of times they have police powers involved, so evidence gets suppressed or squashed. So they get away with all types of crimes, heinous crimes. Child abductions, child sacrifices. I don't even want to go on it. You can read the Franklin scandal for yourself. But I'm telling you, the public needs to become aware that these things are going on, and you need to get behind championing the type of healthcare I'm talking about, which is all anesthetized procedures, and as far as I'm concerned, all hospitalized procedures need to be patient choice linked to off-site servers and legal representatives. So doctors and nurses can no longer get away with this anywhere. They are murdering people and then harvesting their organs, and they transplant. One murdered individual has 2 lungs, right and left lung, heart, liver, pancreas, all kinds of transplantable body parts that literally can generate millions of dollars of revenue. And if you think that's not motive for murder, I'm telling you, you are wrong. And these doctors and nurses work as a team, and then they all agree to lie about the cause of death, if there's anybody that even asks. I'm telling you, in my case, because they found out my ex was poisoning me, they figured I made an ideal target. So I was slated as a victim because these doctors and nurses already have been committing murders and on their own. And when they discovered that my ex had been poisoning me, rather than report her, they blackmailed her. They said, hey, pay us a certain amount of the life insurance, we'll finish him off for you. And I'm telling you, I don't care how unbelievable the story is, it's the truth. They tried to murder me, and I want these people put behind bars, including my ex. Not for vengeance sake, but so they don't think that they can go on doing this to people. And so these types of crimes stop, and also so that they have time to reflect before they die so they don't burn in hell. So the type of healthcare I want is cameras. We have cameras in fast food joints, cameras in our self-storage units. We got cameras in banks. We got cameras protecting trinkets all over the world. But when people's lives are in danger, and they are in danger, in doctors and nurses worldwide, the statistics of how many people die in hospitals, not from what they went in from, but from hospital malpractice and, or, in my opinion, I now know, intent. Homicide attempts, murder, is statistically so high it's inexcusable we don't have cameras in those places. We want cameras that are linked. You can provide your own camera. Bring your own digital camera, link to your own remote server via their, every hospital's networked. Intra-networked and inter-networked. They've got the capability. So you plug in your camera and you link it to your own server at home and record all hospitalized procedures. Frankly, you should link it to your own legal representatives, which brings me to another point. Consumers no longer have a word in our country and in growing places around the world. We need entity formed now, not like the Federal Trade Commission. We need entity formed of firms of attorneys band together to protect the consumer. I personally was left so ill and so sick, I was virtually bedridden. I could not secure legal representation for myself why my ex got away with these crimes and why these doctors and nurses got away with these crimes. The only thing I could do was fax my affidavit to authorities trying to tell them to investigate immediately, which is what I did, and have records of all of it. Logs of all the faxes I gave to authorities in all these jurisdictions, swearing, that I was telling them of the attempted homicides. Now, I might have been wrong about the early motives and stuff, because when I first faxed, I didn't realize at that time my ex hadn't been involved in the whole thing. It took a couple years of what transpired afterwards before I finally, realized her part in all of it, and also by prayer and divine revelation, and also by the evidence of her responses of as I went to seek legal help to secure the arrest of these people. How much adversity I got from her, man, in the process. And once it all came together, then I finally realized the whole truth of the situation. It was very nasty. I mean, basically people, didn't get together up front to conspire to murder me. It just kind of evolved into more and more people agreeing to do so. And it's sad that people have gotten so greedy and so corrupt that that's the case of our society now. But what happened to me wasn't just a rare event. I'm telling you that these people in the hospitals are well practiced, that it's current commonplace, that statistically the whistleblowers that are trying alternative media to get the word out claim that more than 1 million Americans are murdered each year in hospitals, and I believe them. And I'm a voice trying to alert the rest of the public that we need hospitalized supervision, man, at this point, because these people are, unfortunately getting away with murder. At any rate, you walk into a general practitioner and her signs and symptoms, all known globally, worldwide, associated ailments, then pop up. Of those, the diagnostics then pop up. The diagnostics limit the possibilities of the ailments until you have a specified result. Of the specified result, once you have a correct diagnostic via this method, which would greatly speed, healthcare and wellness, and for those frustrated persons like myself, with the current state of affairs of being shuffled from specialist to specialist that really don't know what they're doing. Sadly, I met far too many incompetent, unprofessional individuals in the medical field that frankly must have graduated, from some crackerjack box, man, because I knew more about healthcare than they did. At any rate, and I got treated, man, like an ignoramus, like I was supposed to hang on every word they said like they were a god or goddess. Well, I was just a poor, ignorant person, completely out of touch with my own body, didn't know what the hell I was talking about or what was going on. Man, I was treated, the level of treatment I got, man, was so unbelievably, inexcusably guilty of malpractice, man, that people's mouths would drop open if I had recorded the types of things that were said to me and the things that were done to me by these physicians. I had one physician hang on me like a monkey. Literally. I just can't believe what some of these people did to me. And I was having muscle seizures, man, from the Wilsons, a severe reaction. Now, I'm not talking about seizures like, epilepsy. I'm talking about the kind of seizures where your muscles just literally tighten up and you can't flex or bend or extract from so much pain and agony from the electrical pulses in the brain. Sometimes when they relax, literally cause a Wilson suffer, and especially with what I had gone through, which was all the iron oxide poisoning from the incompatible blood hemolyzing in my system that I suffered each night from, what they call dancing leg syndrome and other things for many years, man. It's taken me a while to detoxify to a point where I can, where I'm still suffering more, but it's bearable for me to try to make this aid now publicly. I was suffering so much for so long, I didn't have the energy to do this, so now I'm going public. At any rate, publicly, you get diagnosed through this database of international experts, so it's not just one physician's own limited experience and knowledge. Okay, you have a correct diagnosis of problem. Then you have treatments worldwide, all known treatments, and everything from, I don't care, smoking bark of shamans to modern big pharma, everything in between. Health through God's pharmacy, and it's the way I would go, but that's my own personal conclusion after all my research. At any rate, the diagnostics then come up much more rapidly, correct diagnostics at that. There's over a 20% misdiagnosis rate, man, worldwide, and even in this country, man. You know how many people suffer because doctors and nurses arrogantly just want you to hang on their words and pretend like, they're just, completely incapable of being fallible? charge you a small fortune for a misdiagnosis that can cause you to suffer and even die. So I'm trying to take matters more out of their hands, to put it more globally in a more agreed universal diagnostics of agreed experts, man, into this database. So you get a correct diagnosis, not an incorrect one, and getting a correct diagnosis, then you get a prescribed methods of treatments. You get the whole list. You get the doctor's recommendation, your personal general physician, or your specialized recommendation with it. But you get the whole list of all known treatments and the success rate for recovery so that you can choose for yourself. In other words, when you go in to see, your local physician and you've got gallstones and your gallbladder's hurting, they don't just automatically rush you into the surgery for knife where they make money and you lose your gallbladder and end up having more health complications with it. You actually find out that, my goodness, gallstones can be excreted naturally. No, I gotta drink, apple juice and some unpleasant lemon juice and an unpleasant amount of olive oil, but heck, that's better than going under the knife any day and a whole lot cheaper. I've asked people with gallbladder issues and liver issues as a result also. I mean, the toxic buildup from the bile blockage and it can be extremely painful. If their physician even remotely mentioned that they can excrete their gallstones naturally, or if he just automatically led to the recommendation of surgery, and universally every one of these people, man, had not one mention of natural excretion of gallstones. How are you keeping your oaths, man, when you're only looking out for your personal profit? The patient's welfare, man. They need to be given patient's choice, patient's rights, patient's choice till the day I die. Man. They've got to be given knowledge, man. Universal global knowledge. This universal database of medical knowledge needs to be compiled and constructed by the agreement of all nations. And the public needs to have access to it and needs to be able to enter into signs and symptoms they may be experiencing from any internet site, even public internet site like libraries, or if they're too poor to afford their own connections, their own mobiles, their own connected device. They should be able to do so through public devices. And if I had my way, universal wellness would be a right so that people, when they went in, could enter in, if they couldn't do it at libraries, at whatever their general practitioner's regional office is. So supervised health care in life and death situations, like all surgical procedures in hospitals and so on and so forth. Frankly, it should all be supervised. These people, man, we are trusting doctors and nurses with our lives. I mean, I am suffering unbelievably for years, man. I've lost all my productivity, all my earnings. I was making, not good money, but decent money. I lost my entire estate, all my investments, everything, on account of these people. On account of the insanity of my ex and her own personal greed, primarily, but had they, reported her when they discovered she had been poisoning me, instead of tried to join in, I wouldn't be in this much pain and suffering. I'd have recovered from the poisoning. What I'm really suffering today from is the long-term effects of having this genetic trait with all the heavy metals that were brought on from the hemolyzed blood and my immune system still, for some reason, attacking my own body as a result of what they did to me. That's why I'm experiencing so much pain, so much fatigue, and so much suffering. That's a fact. And it's not in my head. It's really occurred. I'm really telling the truth, and I wish I could find, because I know there are a few competent individuals, in the world. I wish I could find some of them that would be willing to help me, because I've been left basically impoverished on below poverty level income. I've lost, like I said, virtually everything I owned. I live in a small apartment now, and trying my hardest, man, to recover and to believe that I have better days ahead. I've got an awful lot of knowledge to share with humanity if I can just live long enough to do so. I hope, that I'm speaking to some people out there that recognize that I am telling the truth, and that will assist me and will go on to have, happy and productive lives.